But I really just wanted to thank you for coming to the Ponderers. These sessions are my attempt to start some more robust conversations around the world of careers, get to talk to some really cool and interesting people who are doing some exciting things in the careers space, and sort of start to have a more informal space for us to be able to have these conversations. Today we have Dr. Tanmay Bagade, and I'm really excited about that. In another month, we're going to have KC, who's coming in from the Parramatta Eels Institute to talk to us as well. But today, like I said, we get to talk to Tanmay, who's currently Senior Lecturer at the University of Newcastle in Medical Education and Global Health. He's also the Chair of the Joint Medical Program Admissions Committee at the University of Newcastle. And he's also worked for the World Health Organization and the UN and done some amazing things. I was reading your bio, and I've got to say, I was really blown away by some of the things you've done, Tanmay. So thank you so much for joining me today.
Thank you so much, Lucy. Thank you for your kind introduction. Yeah, I think when you read my profile, you might have thought that, oh, he has done this too. It's like ticking a lot of boxes. So yes, I'm really excited for today's session and happy to have that interaction and space for that opportunity to interact with students.
Yeah, awesome. No, your profile is amazing. We're going to hear all about it in a minute. To start us off, to kick us off, I'd love to get you to take us back to your beginning. What did you want to do when you were at school? Did you always want to work in medicine? What was that like for you?
Well, that's a very interesting question. So see, I'm from India. I migrated here 10 years back. I was in a very simple family, but my father is a doctor. I have around 15 doctors in my family, so it's
Oh,
and it's like a cultural pressure of either you become a doctor or an engineer in most of the Asian parents, and I'm sure that some of the students here would relate to that. But having grown in a family full of doctors, I think that had a deep influence in the way I was thinking about medicine and what whether I want to be a doctor or not. One thing that my father was always doing was he's an obstetrician. He goes in a rural area, does some free health checkup camps, does a lot of free medicine distribution, and to improve the access of healthcare. So that helped me understand that being a doctor is not just treating patients; it is going beyond that. It is something that you have to aspire as a bigger goal of your role in a society, in a community, and what are you going to give back to the community. And those seeds started to grow, and that's how I became I studied and I became a doctor, and then did my post graduation. So it was a long journey, but I think that's how things start for most of the people here.
that's so lovely. We often talk about role models within career development and the importance of these powerful role models. And it sounds like that was what your father really was for you, that,
Yes,
yeah,
yes.
showing you how you could be more. Okay, so obviously there's a bit of a journey between those early days and where you are now. Are you
Mhm.
able to talk a little bit about what that path's been like for you? Maybe start with your training and then talk about the different kind of roles you've taken on and how you've landed in what you're doing at the minute.
Yes. So I have done a lot of work in clinical settings. So I've actually covered most of the spectrum of a healthcare worker. So I'm saying healthcare workers because doctors are part of a bigger picture. And I have worked in global health settings. I've worked in Somalia, Papua New Guinea, Nepal, Ethiopia. So I worked as a clinical clinician, but I was also into the public health and global health space, whereas I was looking at some large provincial level maternal and child health initiatives and reducing the maternal mortality of the province as a whole, instead of just looking at one-to-one patients. Eventually, I thought that it's that the struggle of a clinician is that you can have only a limited impact on the patients. So you can have only you can treat the patient. One patient has got treatment and then done. Maybe you will treat 100 patients in a year, 100 or 300 patients in a year. But then I thought that I need to do more research because before entering the hospital, there is some story to the patients. There are some social, economical factors that impact the patient's life. And that's why they are in that particular situation. So slowly I started to like that public health space and policy related interventions. So I did my research on gender equity and how it affects maternal and child mortality from like a big data set in of United Nations. So I came here to do my PhD, and then I was absorbed by the university. I am academic here, and I think it was I thought that this was not a classical route of a clinician. So you become a doctor and you are practicing in a hospital for the rest of your life. I did something which is not which is out of the box. It is not. It is very rare for a clinician to leave the clinical practice sometime and go into academia, or an academic to pursue leadership roles in admissions, for example, or in different career paths. So I think so long it's quite an exciting journey for me. Yeah.
It's fantastic. I always love hearing people's career stories, and not just like the actual mechanics of the steps that they take, but then also that motivation behind. And you can hear that in what you're talking about, that, wanting to have more impact. And then that goes back to that story from when you were very young and wanting to
Mm,
be able to help people and then bring all that.
exactly.
It's really lovely.
Yes.
Your work obviously spans this really wide range of roles, which, obviously going through your profile, and I recommend to anyone to go and have a look at Dr. Tanmay's profile after this session. But there really are a wide range of things that you do. You're a researcher, a course convener, you're collaborating with international organizations, you're chairing committees, so you're taking on leadership and governance roles. And I know you mentioned before that you wouldn't consider your career to be normal, but what would you consider a normal career for a doctor to look like?
So for a doctor, mainly, see, a normal career should be like you have finished your internship, you have done your training, and then you are doing some clinical work. But from if you step back from that and you think what is your role in a society as a doctor, then you really have to divide your entire career into few components, so that it can help you understand why you have actually started the medicine to do medicine or pursue medical degree. So the maybe first 15 years or 20 years are mostly learning about the system, learning about patient care, improving your surgical, clinical skills. Then the next step is what I am doing. I think it's more about giving back my learnings to the new generation of doctors, train them into clinical skills, train them and help them understand the roles of a doctor. But then, apart from this, I think the third phase of your career should be giving back to the community,
Mm.
because that's where like you have earned a lot of money. You will all be millionaires. We have minimum wage in Australia. I think earning money, everyone can earn money, a lot of money. But what are you going to give back to the community will help you understand your role. And that's what I will be stepping into that in maybe in the next decade. Maybe I will start to do more advocacy work, more. I'm still doing it, but I will be more dedicatedly taking time off my work to do that advocacy work. And I think that's why when you look at a career for a doctor, the foundation is really important. The foundation learning is going to help you be very flexible in your career path. You can go in so many different sectors. It's government sector, private sector. Doctors are also needed in development sector, in the humanitarian settings, like in Medicine Sans Frontiers or with WHO, or with DFAT. Or then you can go into work into pharmaceutical industry too. So you
Mm.
can do a lot of research, biomedical research, do some extensive clinical trials, and discover some new innovations in medicine. So, but I think going back, it's mainly the foundational learning is the more base for your career. So once you do that, you have flexibility to do a lot of things.
Yeah. Do you think that most people who go into medicine now, most young people who are aspiring to be doctors and they're starting their degrees, often I will talk to them and they will have this really clear picture of exactly which speciality they want to go
Mhm.
into and the track they want to go down. Do you think
Mhm.
is that realistic, or are they better off kind of building that foundation and then exploring once they've kind of built that?
Yes, so I can understand from where you're coming, because there are many students who say that, okay, I want to be a cardiologist. And like I wanted to be a cardiologist. I wanted to be a cardiothoracic surgeon. It was my intention. But then when I started my internship, I realized that I think obstetric work is more where I connect with patients, and I like that space, obstetrics and gynecology. And my father is obstetrician, so that was also one of the influential factors. But slowly, I think when you're working in a specific specialty for say X number of years, um, doctors usually, because they are always thinking about new things, what to do next, and we have to be lifelong learners.
Mm.
So it takes you start to get saturated in that space.
Mm.
So usually, if the student says, I want to be a surgeon someday, yes, you can be a surgeon, but what after that? That's the question you have to ask. What after that? You have achieved your goals. What after that? So if your goal is quite long, that okay, at the end of my life, I want to do one, two, three, then that actually helps you to narrow down to a strategy that you can build over for several number of years.
Yeah.
Right.
It's interesting. I love how you break it into that three kind of sections of the career, that foundation and the middle piece, and then the
Mhm.
advocacy at the end. And I can see how for a young person that even just knowing that structure, to expect that kind of structure can help them think beyond, oh, I'm going to be this particular type of surgeon and that's all I'm going to do for my entire life. They can start to think a bit broader.
Yes. And there can be challenges and hurdles in between, because no one's career is a smooth sailing. And even if you get a medical admission or you complete a medical degree, your career trajectory might look different to what other your peers might have. So it's always, there are ups and downs in your career. But always remember that why you wanted to be a doctor. So understanding why do you want to be a doctor? It's not only about money. It is not only about a prestigious degree, but it is something beyond that. And that's where, if you are struggling with that, then just wait, take some pause, understand why you want to be a doctor, and then start to pursue that.
That's really good. Okay, so I also wanted to know, while I've got you, you're in this space where you're working as both an educator and a medical professional. So you can kind of see from both sides. I'm getting a lot of questions at the minute about the future of work, particularly the impacts of things like AI and robotics.
Mhm.
Um, are you, as from your viewpoint within medicine, are you seeing these same sorts of issues and coming up within the field, or are you seeing different technologies impacting on the future of medicine, or do you feel like maybe medicine is going to be a little bit more immune to it than some of the other fields that are being impacted?
Yeah, I think that's an interesting question. So it comes back to what are the future skills that can be done by AI?
Mm.
And will AI assist you, or will AI take over? Okay. But again, taking over is really, it's difficult. I'm not saying it is impossible. There are people who are imagining that the future will be like people will go and just a robot will do the surgery on its own.
Mm.
But human body is so complex. It is, and it's not just the complexity of the anatomy. It is also the physiology. It is also their own stories, which influence their decision of seeking healthcare, or even taking medications or everything. So I think we have to understand that AI is there to stay. It is going to. I always think the positive side. It's going to really be helpful for all the clinicians, mainly to confirm their diagnosis, for example, to confirm. So if you have like multiple reports from different doctors, and you can put them together and try to simulate what exactly should be the line of management. But again, human interaction is also essential. your patient's empathy towards your patient cannot be replaced by AI.
Yeah.
Mental health counseling cannot be replaced by AI. That there are surgeons. Surgeons do so many complicated surgeries which cannot be replaced by AI. Like there are so many bleeders in the body that if there is even a single slight error, it will be difficult. And also the overall decision making process. AI will assist you, but ultimately the doctors will have to do the main decisions. There will be ethical and other concerns which will be important in the next few years, so that we are not giving AI the whole power to make decisions of life and death of an individual.
Yeah.
So again, those complexities will be there, but I don't think AI will take over jobs. It will be assisting a lot of jobs. It will be assisting healthcare workers to make better decisions. It will be helpful for the patients to analyze their own needs. And I think overall AI will be empowering to everyone in the healthcare system.
Mm.
That's what, like, one sentence, empowerment.
Yeah, it's there's a lot of conversation at the minute. We call it augmentation, where AI will come in and will augment what we already do rather than automate what we already do. And I can hear that coming through, which is great, because often you'll read in these reports, we're expecting augmentation, but then to hear it coming from you as well reinforces that that's really what we're looking at here.
Yes.
Now, we've got a little bit of time left. We've got about 10 minutes left, and I've got some more questions, but I just wanted to remind the people who are watching right now, we do have space for questions at the end. So feel free to either pop them in the chat and we can get to them, or just hold on to them and we will get to them at the end. But it always goes much better when we have questions. So please try and think of something you would like to, while you have Tanmay here and the Brains Trust, we'll try and get through those questions as well. Now, I wanted to talk a little bit more practically for careers people around your observations in terms of applicants and aspiring future doctors. So you're someone who gets involved in the process of actually choosing who gets to study medicine. And I'd love to hear about what you consider when you're evaluating candidates and what kinds of attributes you really want to see in those people who you do admit to study.
Yes. So I think that's a very interesting question. When you're thinking of what attributes should be there in a doctor, there are no rigorous studies conducted yet to say that okay, a doctor ideally should have like 4 or 5 of the top attributes. But again, what we are assessing during our interviews or through the UCAT and the ATAR and everything, these assessments are meant to reduce the risk of a to reduce risk of not just for the patients but also for students who might struggle in their future career. Okay, so it's not just one attribute that we are testing. Like we want someone who is going to handle a lot of stress. They are going to make some decisions in a very high stake and high stressful environment. Are they do they have the idea of that? Okay, it's not just motivation to be a doctor. We are going beyond asking those questions. We are asking how good are they with the patients, how good are they with teamwork, with ethics, with professionalism. And so there are so many attributes that we are assessing through our interview processes. That also comes back to the training and everything that a person has in their own life. These things cannot be coached. So there are a lot of coaching agencies which will help the candidates rehearse their answers. They will make sure that they have a very clear script. They will by heart the script, and then they will answer the same questions on the day of interview. But see, we also know that yes, there are students are going to get coached, but that coaching isn't going to contribute maybe 10% into that interview process.
Okay.
It is how well you have developed your skills over time. What were your past experiences in a healthcare system? What were your past experiences in teamwork? What were your past experiences communicating with strangers? for example, because that's an important skill nowadays. People are more hooked onto mobiles, and they are not interacting in a cafe or on the bus. So you will see everyone is just silent in their own zone. And we want doctors to interact with strangers. They are going to interact with strangers the whole time. They are going to disclose bad news. They are going to have some difficult conversations with their patients about like cancer diagnosis, palliative care. So we are looking at attributes which are going to be important for them to thrive as a doctor.
Mm.
We are not eliminating them from the selection process because they are not well, they are not competent enough.
Yeah.
We don't want them to fail in the future. So again, people think that they just want, the university don't want us. It is not you. It is for your own goodwill. So that the next time you are preparing for your interviews, you have built those skills over time. And we are not looking for academically super smart, because at the University of Newcastle, we have so many different pathways. We have almost 10 to 11 entry pathways, so that we are focusing on equity. We are giving opportunities for people who can't who can't get those opportunities elsewhere. So our focus is equity based assessments, and when we are looking at that, we are making sure that we are looking at your skills rather than how clever you are, how smart you are. Okay. And we do have in our assessment, we have a separate section where we write about red flags. Like, okay, this person looks like they have rehearsed their script,
Yep.
so we'll make a note. And if there are a few or more of those comments from different interviewers, then that candidate might not be successful. Even if they have achieved high UCAT score, even if they have achieved high ATAR, it doesn't mean that they can pass the interviews.
Yeah.
So again, those things are also considered in the interview process.
It's interesting that you mentioned, and this isn't in my question list, sorry about this, but it's interesting that you mentioned the mentoring programs, because obviously we've seen quite a few of these coming on board. Are you finding that how widespread is that? Is it almost every candidate has been through that process now? And do you think, do you have an opinion about if it's effective or not?
Now, it depends on how the coaching is tailored to them.
Okay.
So coaching can help only till a certain level. If you have rehearsed the script, it's useless in the interview part. But if the coaching is done in a certain way, where the coach or the mentors have said that, okay, go and get some placement somewhere, go and observe at the hospitals, go or work in some aged care or different settings, like getting experience, the people experience matters a lot. Because again, communication skills, empathy, these cannot be generated by a mentor.
No.
And you can be a very good actor, but again, the acting can get you an admission to a medical school. But for the person to get successful and be a successful doctor, it takes a lot of different work.
Thank you for that. I also wanted to know, obviously not everyone is going to be able to actually get in to be a doctor who says that they would like to be a doctor. Do you have any, for those people, I know a lot of them go on and do things like biomedical science, but are there other pathways that you think these people could be considering that may be a little bit broader that would still have them working in healthcare, working in this field, but not necessarily as a doctor themselves?
Yes, I think this is a fantastic question and a very important one, because I think when a candidate does not get through the medical course, or they don't get admission, they feel that it's a failure, and then they have to accept something which they consider, or which the society consider as a second option. But it's not a second option. It's always like, think about what is your bigger, broader goal in life. And there are fantastic careers in like nursing, midwifery, emergency nurses, and nurses actually. I have learned a lot from the nurses. Like I have learned some of the suturing skills from nurses. I have learned some very crucial signs and symptoms, how to see some specific signs symptoms in a patient from the nurses,
Mm.
because they are interacting with the patients for longer time than a doctor.
Yeah.
Okay, so I think nurses or allied health professionals, physiotherapy, occupational health, or any other like radiography, these are also very important careers. So it's not like the end of the story that, oh, I'm just choosing a secondary option because I could not get into medicine. And because see, again, I'm coming back to the same point that you can earn a lot of money, but again, think of what you wanted to do in the first place. Why do you want to go to medicine? And you can use the other options even to pursue that same exact goals in life.
I love that. I love how you put that, because that's how whenever I'm having conversations with aspiring doctors, that's usually what I'm saying. Let's think about what else you could be doing.
Yeah.
Look, last question, and just a quick reminder again, if you do have questions for Tanmay, please put them in the chat and we'll get to them in a second. But while I've got you here, is there anything you wish that you could say to careers advisors, guidance counselors, people who are working with high school students and young people who are aspiring to be doctors? Is there anything you would like them to know?
Yes, so I think that I feel that every candidate that you are counseling, they need to understand what does it mean to be a doctor. What are the and it's again looking at what skills should be developed in a individual. So instead of looking at their previous track record, their scores in academic scores, maybe look at what skills do they have and what skills can they strengthen.
Yeah.
So whether they have good communication skills or not. If yes, then yes, that you can build on top of that. Or do they have ability to talk to strangers? Are they effective in communicating complex text? Are they good in decision making? Are they good in analyzing, in making decisions in very stressful environments?
Mm.
Like we make decisions almost every day. We are decision to be a doctor is also a decision which goes through a lot of process. But when it comes to patient care, the decisions are quite complex.
Mm.
So focus on their skills. I know that it's quite difficult to give them one structured answer, but kind of building them skills, helping them navigate through the process of the application, and what skills should they focus on for the next few months before they have started the application process. I think that will be really important.
That's fantastic. And I will use that advice with my own students.
Mhm.
Okay, we do have a couple of questions which I will share with you now. So from Andrew, we've got, do candidates need to have completed one of the preparation programs, coaching programs, or do you think people can perform perfectly well without that kind of preparation?
Yes, I think you can perform. Yes, yes is my answer. You can perform really well without any coaching from anyone. Yes, if you have the capacity, if you have the skills, if you have attained those skills over a number of years, you can crack all the interviews very easily.
Great.
Okay. And the interviews in our interview process, we all are very passionate about medical education. The whole interviewers team, we all want good students. We want students to thrive in our university. So we are not giving them like we are not putting them down.
Mm.
So we want that, okay, try to answer this question in a better way, and we'll give them more chances.
Yeah.
And again, that's why we have like 6 stations, so that if you don't perform in one station, maybe if you have performed in the other stations, you might still get in.
Yeah. I love that. And I love that it goes back to the equity piece, right? It goes back
Yes,
to giving people that opportunity to succeed if they can do so.
exactly.
I had a quick question from Tamara, who's asked, are all medical courses as good as one another across universities? Now, I would suggest yes, but I'm not an expert. She says that she has some students who think they should only study at certain universities because they're the best courses. But is that in your experience the case, or are they really relatively similar across the country?
It's similar across the country, mainly because all medical courses all over Australia, they go through the AMC accreditation process. And it is quite a rigorous quality assessment of each courses. So they look at patient-teacher ratio. They look at the funding that the students have, the infrastructure. They look at what are the resources that the university is putting into medical education. So it's a very rigorous assessment of all the medical courses. So anywhere in Australia, if you are in medicine, that is fine.
Yeah.
So and always try to get something which is nearer to the home so that you can reduce your travel time and be within your network of friends and family.
Yeah, that's the good, because that's what I say to students is, no, they're all excellent. Just pick the one closest to you.
Yes. And no one in the future, when you are going for interviews, no one is going to ask from which university you did your graduation. They'll just ask, okay, do you have AFRA registration? And that's all. And they will ask you about your skills.
Yeah. Okay. No, that's great to hear. We also had a question about work experience, which is one I do get outside of this kind of context quite often, and not just for doctors, but anybody who wants to work in healthcare. Obviously, it can help them if they've had some sort of experience, even if it's just a conversation or the opportunity to volunteer. Do you have any tips or have you seen any good examples of young people going to get work experience, acknowledging there aren't a lot of programs around?
Yes, and I think internships are fantastic opportunities, like internships or volunteer experiences at NGOs. There are like also hundreds of NGOs in Australia as well as outside Australia. So even outside Australia, there are NGOs which are looking for volunteers. So you can look at overseas experience or experiences in Australian settings itself.
Okay.
And sometimes there are opportunities with the government agencies too. So, for example, Australian government's overseas development assistance programs. They fund a lot of NGOs to do some work in different countries, like mostly in our South Pacific region. So maybe connect with some of those NGOs, like you have DT Global, we have some Medicine Sans Frontiers is there, but Medicine Sans Frontiers needs a bachelor's degree. But for other, like there are smaller NGOs which you can try and, okay, I want to just volunteer, I want to get an exposure or just learn about different things. Then yes, you can volunteer and do some internships there. And that's a good starting point. Sorry. Yeah.
No, that's excellent. Extending on that for a second, when you see these candidates, do you see any of them who've done part-time work that's been particularly valuable, like in aged care or in pharmacy or something like that? Does that help at all?
Yes, a part-time work where they are working with people.
Okay.
Is very valuable. So I had a candidate a few years back, which she was working at McDonald's.
Yeah.
Okay, it was, and because that's also a highly stressful work, because you have to manage time. There are like so many things going on simultaneously. You have to look after billing. You have to do hundreds of things together. So if someone has worked at McDonald's, I know that they are excellent candidates because they will have good communication skills, they'll have good teamwork skills, and they will be very good in conflict management.
Okay.
So when you have skills, these are the skills that are needed for a doctor. Okay, so if such work experience is there, fantastic. I think that's going to give you an edge over other candidates. But I'm not saying go and work in McDonald's. But again, part-time work can be anything of value.
With people. Yeah, I love that. My son's just been working at KFC, so I totally understand the conflict management side of this. Okay, G. Riley has asked, do you have many students from New Zealand that come across to study at University of Newcastle?
We do have a few, but every year we have very few, because again, New Zealand still we do take some of the students from there, but I don't have the exact numbers. Sorry, I can't answer the exact numbers.
That's good to know that you have some. So Tamara's asked again as a bit of a follow-up. She said it is quite difficult with parents, which I'm sure you can appreciate, having family expectations of your own when you were younger. Tamara's asked if she's dealing with a parent who's insisting that the young person becomes a doctor, but it's quite clear that that young person is probably not necessarily on that track. Are there any other specific occupational roles that you would suggest that might meet that parent's expectations and be in healthcare, but without necessarily being at that same requirement?
Yes, that's a difficult question because I don't want to offend any of the parents.
I know what you mean.
But
It is a very difficult one to answer.
yeah, but again, if you go back to what you wanted to do, and again, parents want the best outcome for their children. Like even I will suggest that my son to say, okay, either become a doctor or a lawyer, and he's just 13. So when I have such conversations with him, we'll say, I still have like 5, 6 years. Why are you talking about this? Okay, so so again, you can't. So parents have their own thoughts and they want the best outcome for their child. But ultimately, it is the conversation between you and how you navigate it. There are so many different careers. Like I said, nursing, allied health are there. Apart from that, public health, epidemiology, healthcare management, like these are some very rigorous and very good degrees, where like if you have good math skills and statistic skills, maybe just do a master's in statistics and you will be like top of the game, because statisticians are always like, needed in almost all the projects in Australia. So there is a huge demand and supply gap in terms of statisticians or epidemiologists or public health workers. So I think those fields are also really good. And with these degrees like public health and epidemiology, you can even explore in going to international agencies such as United Nations. When I was in WHO, I to just get more ideas about health management and public health, I did a master's in MPH and a health management degree. But that actually gave me more experience and more skills that I could apply in my settings. And even now I'm in public health. So it's good. It gives you good research skills. It gives you good ideas of the overall population health, and you can have a huge impact on the population. So doctors might be treating, like say, I said around 100 to 300 patients, but public health workers, their impact might impact like millions of people in the population. So think of those opportunities. There are like international affairs where you can get involved as a doctor, or as a health professional. And United Nations, there are like almost 15, 20 United Nations as well as their sister organizations. Even World Bank is one of the like it's not a UN agency, but it is again it's huge in healthcare. It has a healthcare pillar. So there are opportunities even there, like health economics, health management. Again, if you want to convince your parents, look into convincing them with saying that I have explored these opportunities, which I feel fit into my role and to my goals of life, and I want to do this, and maybe they will get convinced.
I love that. That's a fantastic response. And it's so true. There's so many roles we need, so many health management, as many as we need doctors. So
Yes,
no, I appreciate that for a difficult question. I'm really appreciative. I've learned a heck of a lot today about the entire process, and I'm so grateful that you were willing to come and have this quite open conversation with me.
no problem at all.